Hi, my name is Rachel Revena, and I am currently finishing my music therapy master's equivalency program at the University of Minnesota. I hold multiple degrees from the University of Northwestern St. Paul, including a music degree and a psychology minor. Teaching private piano lessons since high school, I earned the Student of the Year award from Minnesota Music Teachers Association, MMTA, in 2013, and am a member of several music organizations, including MMTA, AMTA, Music Teachers National Association, MTNA, and some local chapters for music teachers. My special interest is teaching adapted lessons for students with disabilities. I have experience working with people with disabilities at various camps, at Bethlehem Baptist Church's Disability Ministry, in Ukraine, and in music therapy settings. In my free time, I advocate for people with disabilities, receiving the Friend of ADA Award from Northwestern in 2015 and an advocacy scholarship from Learning Ally, which is an audiobook program, in 2018. I blog for the nonprofit organization Positive Exposure at positiveexposure.org/Rachel R. The role of music therapy in hospice. Music therapy in hospice is for the music therapist to provide relief, spiritual opportunities, and healthy pathways for grief for not only the individual in hospice, but also that person's loved ones. Since music therapy can help with pain, according to the gate theory of pain, which you can read about in my essay questions later, I would try to bring physical relief to the patient while paying close attention to make sure that I am helping and not causing more pain. Not only can this bring relief to the patient, but for the family, seeing a loved one in pain and feeling helpless to do anything about it can cause great anxiety and agitation. So seeing the creases of pain be replaced by rest or sleep or singing even is a huge relief for family members as well as for the individual. One of the questions says, what is the most important aspect of a music therapy sessions? And I think one of the most important aspects is connection. And not only is this the connection between the client and the therapist, but in hospice settings it would be between the client and his or her family, and between the family and the therapist, and even the therapist and all the other doctors and nurses who the therapist is going to come into contact with. So after the passing of the loved one, there's also connection that has to be focused on. And the music therapist can help with grief and with the way that the family and friends will now relate to their loved one who has passed away, which will include memories, grief, and maybe lost memories that recently came back, maybe making a memorial book or kind of a scrapbook about the loved one. As a music therapist, I could also help with the spiritual part of hospice by playing hymns and spiritual songs that are helpful for the loved ones, and for the client before he or she passes. And this helps in the process of dying, grief, and the first glimpses of healing. And when the person in hospice can really feel connection and trust for the music therapist, then we can start to process things and be ready for change.